This is my patient Sierra here. I'm going to be doing a nose, mouth, and throat inspection on her. I'm going to look at her nose first. It is midline. It does look symmetric on both sides. Can you look at it for me? Her septum is intact. The nares holes do look symmetrical. I'm going to look inside of her nose. And there's no lesions. Doesn't look like there's any sores. The hair is distributed evenly. I'm going to palpate her nose. The bone is hard. The cartilage is spongy and movable like it should be. Palpate her sinuses. Any tenderness? There's no swelling, no bruises. I'm going to block one side of your nose. Can you breathe about this? Okay, and then this side. Thank you. Alright, I'm going to be inspecting Sierra's mouth and throat. First of all, I'm going to look at the outside of her mouth. I'm going to look at her lips. They are symmetrical. I'm going to palpate them. There's no lesions, no masses. Have you had any problems? Have any concerns? Okay, I'm going to ask her to open up her mouth. I'm going to look at both sides of her cheeks. They are normal within color range. The pigmentation is same throughout. They are moist. I'm going to look at her gums. They are pink and moist. They look the same throughout. Her teeth are all intact. She doesn't have any missing. They are white. They are taken care of. I'm going to look at the floor of her mouth. There seems to be no lesions or bumps. There are some veins down there, but that's normal. Look at the roof of her mouth. It looks smooth and pink and moist. No lesions or bumps that I can see. You stick out your tongue. Her tongue is a pink color. It is moist. Can I see the back of your throat? Can you say, oh? Her uvula is midline and intact. Her tonsils are intact. They're there. They look normal. No swelling or no bumps on them. You do all one more time. Her soft palate does rise when she says that. Her hard palate is intact also. And now I'm going to assess her, or look at her retropharyngeal wall. It is intact. It's smooth and looks moist. I don't have a tongue blade, but have you been able to swallow okay? So, since she has been able to swallow okay, her gag reflex is intact. I'm going to be doing a breast inspection on my patient here. I'm going to lower their shirt down. First, we're just going to look at the characteristics of their skin. The pigmentation on both sides is even. I don't see any lesions or bruises. I'm going to look at the nipples, and they look symmetrical. They are both brown. And I'm going to palpate both breasts and both nipples. They feel symmetrical. There's no bumps or lesions, no swelling, no tenderness. I'm going to feel their lymph nodes. You can do it on both sides, down their arms. Look for any enlarged lymph nodes, any swelling, any tenderness. They don't have any. You're going to, after you've done that, you're going to ask them to put their hands behind their head, which is the mannequin, so we can't do that, but ask them to put their hands behind their head and bend inwards a little bit, and you want to make sure that there's no characteristic changes there. You're going to also have them put their hands on their hips and watch for any characteristic changes, feel and palpate, and ask them to lean forward and do the same thing and make sure there's no changes within any of that. You're going to look at the chest wall as well as everything else and make sure there's no swelling, no tenderness. And there is none. It's symmetrical on both sides. I'm going to be teaching my patient how to do a self-examination every month. You do it once a month, regardless if you're male or female, because you can get any kind of lumps or bumps or any kind of cancers. Regardless of your gender, you're going to take your fingers, the pads of your fingers, and gently massage and go around just a circle and go outwards, and do that on both sides. And if you have any concerns or any problems, just make sure that you talk to your doctor about it.